Hello, my name is Kevin Nicholson. I am the Director of Rehabilitation Services for Vibra Rehabilitation Hospital in Amarillo, Texas. And I would like to talk to you briefly about injuries to the older population, specifically orthopedic injuries. Things such as hip fractures are one of the more common admitting diagnoses that we see here in the rehabilitation hospital. Injuries such as this to the older population, those 65 years of age and older, are quite common. In fact, the Centers for Disease Control tells us that hundreds of thousands of older people each year suffer some type of severe injury, such as a hip fracture. And so it makes sense that we do things that we know can help to prevent the likelihood of hip fractures before you need services such as rehabilitation, hospital services. There is good news. There are things that can be done to help reduce the likelihood of orthopedic injuries, in particular hip fractures. One of the most important things is strengthening exercises. Many times we see elderly people who become very weak. They lose muscle strength. Maybe we're seeing this more during the pandemic as well, with older people not getting out and being as engaged in their community as much. They suffer a progressive loss of strength, so it just makes sense that we intervene with strengthening exercises. In particular, resistance training exercises are very important for the elderly population. Things such as simple weightlifting activities, working with elderly patients on how to even get up from low surfaces such as low chairs, toilets, things such as this. These things can be done on an outpatient basis very easily with a well-trained coach who can teach them how to incorporate resistance training exercises into a normal daily routine. Hopefully this has been helpful to you. And if you have any further questions, reach out to us here at Vibra Rehabilitation Hospital in Amarillo, Texas. Thank you.